for joining us for Healthy Hearing with Dr. Ulrich. This is a show about hearing loss, treatment options, and the importance of maintaining your hearing health. I'm Dr. Adrienne Ulrich, audiologist and owner of Parkway Hearing in West Roxbury, and I'm your host for this series. In this episode, we're going to be focusing on a hearing issue that affects more than 5 million Americans, tinnitus, also pronounced tinnitus. One of the most common hearing-related ailments, tinnitus affects more than 15% of all people and manifests as noises in the ears that can come and go or happen consistently. And it's described varyingly as ringing sounds, buzzing sounds, roaring, clicking sounds, hissing, or even a humming sound. I work regularly with our military service members, and the number one related concern those veterans report to me are their tinnitus symptoms, often caused by noise exposure while they were serving. Overall, 80% of individuals suffering from tinnitus also have hearing loss. For many patients, tinnitus is disruptive enough to their daily lives that it's more urgent for them than their hearing loss concerns. You might think that tinnitus is such a common problem that there are proven solutions and that they're commonly understood as well. But unfortunately, patients go to their doctor or sometimes even an ear, nose, and throat specialist, and they're often told that there are no treatment options. This just isn't the case. While there isn't a cure for tinnitus, there are treatment options with a proven efficacy. And I'm passionate about hearing health, and I hope to make these options better known and understood to the general public because they can make a big difference to the quality of life for the millions of individuals suffering from tinnitus across the country and many more worldwide. Today, we're going to learn about tinnitus and some of its causes, science-backed options for its treatment, and what kind of a difference that treatment can make to the daily life of someone suffering from this common hearing condition. I'm here today with two people. One is my patient, and her name is Susan D'Eugenio. And I also have with us today an expert on tinnitus, an audiology colleague and friend, Dr. Deirdre Anderson. Thank you both for coming today.
Thank you for inviting us.
I wanted to start with you, Susan, and have the viewers at home learn a little bit about your information on tinnitus and your sort of backstory to what brings you here today.
I had retired and I started hearing a hissing noise. Well, I continued hearing it, but before I was in school, and so I assumed, oh, it's background noise, I'm busy. And then it was the air conditioning. And then it was September, my heat wasn't on. I have an old house with radiators and I'm hearing this hissing sound. And they weren't on, and I thought, what could this be? So I thought about going to a hearing specialist, but I thought tinnitus was just a ringing sound. But someone said, no, check it out, and then I realized it could be many different sounds. Mine sounds more like a white noise to me.
How long had you been having the sort of hissing sound before?
You know, in retrospect, it's hard to say because I was busy in the school and with noise all the time.
So you were a teacher?
So, yes,
Okay.
I didn't really notice it until after I retired.
Okay.
And then when I was sitting there and air conditioning wasn't on, so it wasn't that noise, in a quiet room I started hearing just this white noise kind of sound or hissing, like you might hear from a radiator. And I realized something was wrong. And that's when I decided to go to you and see.
Well, that's a good story. So the information for you was that there was something manifesting, you were hearing it more frequently, particularly now that you weren't working as much, and it was concerning for you.
Yes.
Okay.
Yeah. And they're so small, I do have to show people. If you're thinking, well, my gosh, what are they going to look like? They're wonderful. So.
How long have you had them now?
I've had them a year now.
Okay.
I retired last year, and that's when I got them.
So you're working with a device that is a traditional hearing aid, a very small one, and that device does what for the tinnitus?
It really drowns it out. At first, when I went to you, I still heard it a little, but I don't know how much of that was in my head or what. But I'd say after a few days, you don't even realize it. Before I had the hearing aids, and I realized it wasn't a background noise, it seemed deafening to me at that point. It was just so irritating and aggravating. But with the hearing aids on, nothing.
Was it an immediate difference?
I'd say 2, 3, 4 days.
Wow.
And then I was at a point where I had to say to myself, am I hearing it? So therefore, it wasn't being a factor in my life at all. So it was so helpful, it was worth it.
Oh, that's excellent. And do you feel like the tinnitus sound kind of escapes when you take out the instruments as well? Tell us a little bit about your
Every
experience.
so often, if I'm in a very quiet room, say there's no television, radio, or conversation, I will hear it. But it's not the factor it was before.
Okay.
It's not totally consuming as it was when I realized what the heck is wrong. You know, now that I know what it is, and I can just put the hearing aids back in, and it's fine.
Oh, that's excellent. So in terms of the instruments and the relief that it gives, you still have some opportunity, or some times where you notice the tinnitus still, because it doesn't just take it all away.
Right.
It's that perception of that sound and that it's less noticeable to you.
Absolutely.
Was it something before that you noticed was exacerbated by certain things, if you were feeling stress or anything related to that for you?
I don't think so. I can't really pinpoint a particular incidence or feeling when it seemed to exacerbate it.
Okay.
So,
Oh, that's great.
yeah, it's great. Very beneficial.
And that's a common type of scenario, I think, with the patients that we work with, is that they sometimes don't realize that there are treatment options for the tinnitus.
Yes.
You want to speak to that a little bit,
They
Deirdre?
really don't, and I think that when you go to your primary care doctor and possibly an ear, nose, and throat specialist, you may feel discouraged because, number one, they don't have the information or they don't have the training to kind of point you in the right direction for treatment. So many people will arrive in the office feeling like, well, I don't know why I'm here. You know, they don't have the expectation that there's help and that there's hope, but there definitely is.
Absolutely.
And a lot of people will, just by treating their hearing loss, really habituate their tinnitus and make it go into their subconscious. And that sounds like what it was for you. So, you know, many people are more motivated to, you know, I just want to get rid of this tinnitus. They don't realize the connection to hearing loss and how treating the hearing loss, feeding your auditory cortex with good information will help, you know, push that tinnitus down.
Well, and I want to talk a little bit about the experience that you and I have had, because we've both taken a very special course on tinnitus retraining therapy with a pretty famous neuroscientist, Dr. Powell Jasterboff. And you've been doing more of the protocol and treatments a longer time than I have. What brought you into tinnitus as sort of a subspecialty of audiology?
I would say it was my patients, because people would come in. I mean, it didn't just arrive here it arrived to me when I first started being an audiologist, and people would come in and talk to me and say, this is driving me crazy. What do I do? What do I do? And I really didn't have a good answer for them, because as an audiologist, I was not trained in any sort of treatment because it didn't exist 30 years ago. But little by little, I started doing some research and learned of Pavel Jasterboff and tinnitus retraining therapy. So I went and was trained with him 20 years ago, and it's been a wonderful thing for me to offer my patients. Everyone is very grateful.
Talk a little bit about what your protocol looks like. So you have a patient that comes into the office. They may have symptoms that include tinnitus, maybe even hearing loss. They're struggling. What's the next step for them?
Well, if they have enough hearing loss, we talk about hearing aids and talk about the importance of treating the hearing loss. If they're really struggling, I incorporate a second listening program where their amplification is mixed with some white noise. And that helps suppress the tinnitus a little bit more. But in my protocol, you don't want to completely cover up your tinnitus, because if you completely mask it, you're not training your brain to habituate it. And so if they go into their second program, they sit with me, we determine the proper settings for them, and then they use that maybe exclusively during the day. Everybody's different. Everybody's got a different brain, everybody has a different experience. So whether they're only using hearing aids and having success, or using a combination of listening programs to have their success, whatever works for the patient.
And the secondary program that you're describing is part of their hearing aids and their devices that go along with their hearing loss.
Yeah, it's programmed right into their hearing aids, and all these hearing aids today come with an app on your phone. You can just go to your phone, okay, I want to go to program 2, boom, 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 I've done it. And it's very easy.
What about patients that do have the tinnitus but may not be at the point where hearing aids are an appropriate treatment option for them?
Yeah, then, I see plenty of people who have normal hearing and big issues with tinnitus. And what do you do then? They don't need hearing aids, but they need what we call sound generators. They look like hearing aids. They're very open-fitting, so they're not going to interfere with their hearing. And they put out a white noise. And again, they wear them all day, minimum of 8 hours. They have a little loudness control, and you can change it to where you find what we call the mixing point, where you're mixing with your tinnitus but not covering it up completely. And these people are in a long-term program, I'd say 8 to 12 months, sometimes more, of wearing them every day to train their brain to habituate tinnitus.
And once they do that, can they completely withdraw from the device that they're using?
In my experience, yes. People will say, well, how will I know? Well, you'll know when you wake up in the morning, you're not thinking about it, you're not monitoring it, you're not worried about it, and you'll probably go out the door and forget your sound generators. That is all good. Or you may think, well, I'm doing great. I'll just stick my sound generators in my pocket. I'll have them if I need them. But people learn that as they go along. And really, in my experience, well over 85 to 90% are able to habituate in 12 months.
That's incredible.
Yeah, and it's not a cure, because I also tell my patients, you'll do great, you'll habituate. Now, 2 or 3 years from now, you might feel like your tinnitus spikes on you, because they call me sometimes. And I'll say, well, what's going on? Usually it's stress-related. And I say, okay, pull out your sound generators, get back into the program. You know what the plan is, you know what to expect, and you will habituate even more quickly.
I feel like habituate could be a term that not everybody hears every day. So explain what habituate means.
Habituate means your brain recognizes a sound, deems it as neutral, and pushes it into your subconscious. So people who live around railroad tracks or near the airport, they habituate those sounds because they're not threatening to them. They forget about them. And then, let's say, then somebody comes over for lunch and they look at this person, how do you live here? And they're like, what do you mean? And it's those planes, that railroad tracks, I forget about it. That's habituation.
Changing that perception.
Changing that emotional reaction to neutral is really important.
And you also work with patients that suffer from hyperacusis and misophonia. So I was hoping you could talk a little bit about that. So maybe we'll start with hyperacusis.
Yeah, I would say half the people who present with tinnitus will have some degree of hyperacusis. And hyperacusis is a kind of an abnormal perception of sound. So things get loud for them way too quickly. A normal person can tolerate 100 decibels, 110 decibels, even if just for a quick couple seconds. It doesn't really, you don't go crazy with it. But someone with hyperacusis, if a sound is 50 decibels, 60 decibels, 70 decibels, they're saying it's way too loud. So again, there's a lot of pairing of emotion with this response, and they develop hyperacusis. And a lot of people feel that, I should always be wearing earplugs to protect my ears, but that will give the opposite effect. Because if you deny your brain sound, your brain will become more sensitive. So wearing earplugs will make it worse.
I think that's an important point to drive home, because a lot of people think if I'm so sensitive to it, I should just block up my ears. And it can be very debilitating for patients that experience that, because then they want to stay in their house all the time.
Right.
They're afraid of going outside because they can't control the sound in their environment as well. Yeah. So what do you do for those patients?
Well, number one, we talk because they have to understand how their current behavior is working against them. And then they've got to understand the emotional reaction to sound that they're having. And then we talk about building tolerance. So we go back to the sound generators. And if they present with tinnitus and hyperacusis, we deal with the hyperacusis first. They're wearing these devices, which are very comfortable. They set them to what is comfortable for them, and they wear that 8 hours a day. And they keep doing that, they keep doing that. They're teaching their brain to be comfortable with sound. And then they're also going to treat their tinnitus too. But they have to get comfortable with sound, and then they have more confidence, they feel better. So now I encourage them that the sound generators is just one avenue to treat your hyperacusis. Turn on the radio, go out and walk in the woods. You need to get out and let the sounds of the world be your friend. Mm-hmm. When you have hyperacusis, they're usually your enemy.
Yeah, and it's a hard thing to kind of counterbalance that too. So it makes sense to start with the sensitivity to the loud sounds before you can tackle the hearing loss or anything else, the tinnitus as well.
Yeah.
And another sort of vein of all this is something called misophonia, which truthfully I didn't have much experience with before working with patients that experience it. And some good examples of that in my practice are patients that can't stand people chewing. That's a big one. That at the dinner table, if in the proximity that you and I are, it drives them crazy to hear a chewing sound or something that is just part of their family dynamic. There's treatment for that as well.
Yes, but I find those, to be my most challenging group. They're usually teenagers, and these young people have not dined with their family in sometimes years. They can only take their meals up in their room by themselves. So you think about that. The whole family's been disjointed. They're dysfunctional in that way. They can't share meals together. So it's very isolating for the child, for the teenager. But again, you have to introduce sound. We can sometimes use sound generators if I feel they're old enough and mature enough to handle them. Many of these misophonia kids, they're 8 years old, they're 10 years old, and I'm very reluctant to do the sound generators. But in lieu of that, we talk about sound therapy. We're all sitting at the dinner table, maybe a white noise machine under the table, maybe some music in the background that's agreeable to everybody. Just to get some other sound in there to be kind of breaking up the perception of the chewing, of the breathing, of all that stuff. It takes a whole family to solve this. And you really, when they come in, I encourage both parents to come so that we can all talk. And it's a long-term thing. And why I feel they're most challenging is you're dealing with a young brain. A brain is not really fully formed about 25 years old. And here we have somebody between 10 and 16, 18 years old. It's a work in progress as they mature, as they get more ability to understand what it is too. But we can manage it, and that's the hope, that's the message. It can be managed. I've had misophonia kids that have been in high school with sound generators. They wear them to school. It helps them be in the classroom, get their work done, and then they go off to college, and then they have to share a room. And that's a whole nother difficulty. But if they have their sound generators and probably a fan in the room, they can manage. So, it's so much about healthcare in general is managing. We manage our conditions, we manage things day to day, but we can do it successfully.
I think that's an important point, that there's no magic bullet, there's no, magic pill, there's no surgical interventions for what we're talking about, but there are treatment options that have proven success. And that's a real important piece of the puzzle, because I think a lot of people suffering just don't do anything about it or make their world in a smaller space because it's more comfortable for them to do that. They don't leave the house, they don't interact with people. I have a misophonia child as well, and the experience with the family was a difficult one. It was chewing for him that was a real sensitivity for him. So we started where he would eat in the same floor as the family, but in a different room. And then we would have him actually turn away from the family and sit in a chair in the same room as the family, but he wasn't able to use the visual cues of who was chewing next, so that he was hearing and not sensitive to it. It took a long time before we could turn him around and actually have him face the family and be a part of the table. But he does it now beautifully, so it's really nice to see the remarkable changes that can happen, and given the family and the support system that the family provides to make it that positive aspect. Yeah.
It's a good thing.
It is, it really is, yes. I'm so grateful that you're doing so well with everything too, and that you've seen some great success with your own tinnitus and feeling like it's really benefited
I have, and
you.
I've mentioned to some of my other friends who've retired about it, because rather than letting it limit you, tackle it, see what can be done, and you'd be amazed. It's so easy to read something online that is depressing. There's no cure. But when you go and you find out the alternatives and how you can train your brain, it's very enlightening and encouraging, and with me it was very successful.
And it's important, I think, for people to know too that this is part of the scope of practice of an audiologist, so
Yes.
that a doctor of audiology is within his or her scope of practice to support and care for these patients, because it is a different space than the traditional hearing loss and now we're going to do something about it, or you have a balance issue and now we're going to do something about it. So it's sort of definitely a subspecialty within audiology. And now that you're part of sort of this tinnitus retraining therapy, are there a lot of people in Massachusetts or even within the United States that have this training that you're aware of?
As audiologists, no, I don't think so. It's really, people travel to see me from other states, that's for sure. So there's not a lot of audiologists that are trained in it. I think you really have to really have an interest in it and really want to do it, because it's different from just dealing with hearing loss and hearing aids. You're dealing with kind of a psychological level of understanding that, and more time spent too, that makes it kind of narrows the numbers of audiologists that want to do that.
I want to thank my guests today for joining us, and stay tuned for the next episode of Healthy Hearing with Dr. Ulrich. Thanks for joining us.